Okay, from the sensory tests, we can then move on to the motor tests, the resisted movement tests. And these are done to a maximum contraction so that we actually try to break the patient's contraction so we can tell whether or not they do have full strength. And we're not simply looking for the amount of strength or amount of power that the patient can put out, but we're also looking for how fatigable is it, because neurological weakness is also abnormally fatigable, and it will rapidly fatigue as these tests are repeated. So as we do the first contraction, we need to sustain the contraction a little bit as we break it so that we can feel for, first of all, weakness, and then the feeling of fatigue may come on. But in the presence of weakness, we can then go in and repeat tests and look for abnormal fatigability. And again, with this test, we're looking for the distribution of the weakness. Does it fall into a segmental, multi-segmental, or non-segmental pattern, which would suggest root palsy, spinal cord or central nervous system problems, and peripheral nerve problems, respectively. Now, how you do these tests really depend on the relative sizes between you and the patient. And in some patients, you're going to have to be in a much better position and disadvantage the patient before you can effectively achieve these tests. I'll show you how I would do them normally on somebody of Beverly's size, and then we can look at one or two variations on some of the bigger patients. Just move across towards me a little, Beverly, would you? Thanks. Okay, so I'll call out the generally accepted routes and the key muscles we're testing. So hip flexion would be L1, L2, and the instruction is don't let me move your leg. And you just apply enough pressure to break through it. If it had been found to be weak, then I would repeat this. I'm not going to do this for every muscle, but I'll do it on this one. If it had been weak, then I would have said, don't let me move it, don't let me move it, don't let me move it, and repeat this up to half a dozen times. And I'm looking for this to really fatigue very rapidly. So L1, L4, dorsiflexion of the ankle. Don't let me move you. And compare to the other side. Don't let me move you. Okay. L5, eversion. Same instruction. Don't say don't let me put your foot in. Just don't let me move you and shift your pressure to the outside of the foot there and compare it to this side, and they'll automatically resist inversion if you do that. And that is actually, it's L5, but it can be S1. Occasionally this is S1 in people, and you'll have to line that up with the other tests. L5, toe extension. Pull your big toes up. Don't let me move them. And like so. And we can see actually that the left toe is a little weaker, but it's not fatigable. Now, one of the reasons that you can get weakness here is they can tear the retinaculum that holds the tendon down. What you can do is, just relax for a second, come in and stabilize the tendon yourself. You be the retinaculum and then repeat the test. Don't let me move you. There. And if it strengthens up, that was the original problem, is this torn retinaculum. Okay, turn over for me, Beverly, would you, onto your stomach, or actually onto your side. An alternate muscle for L5 is the hip abductor. So don't let me move you, and just test through there, and lay on your other side, and we'll compare it with the other abductor of the hip. Don't let me move you. Okay, lie on your stomach. The quadriceps, being very strong muscles, we'll need to generally test these in prone. It's easier to do. Now put them in a disadvantaged position. That is, we'll put them in the lengthened position there, and put your shoulder against the leg like so. And again, don't let me move you, and you just lean into them and feel for that weakness. And the same on the other side. Don't let me move you, and just lean in. Now, on a very strong person, you're going to have to move around the bed and test it the other way. For S12 knee flexion. Now, this is notorious for cramping. So to avoid that, first off, have the leg in the outer range for the, or at least towards the outer range for the hamstrings. Put your other hand over the hamstrings, and these two strategies will reduce the risk of cramping. And then don't let me move you. Like so. And don't let me move you. There. Also for S2, but S2-3, we can look at the strength of the hip extensors. Now, if you do it by having them lift the leg up and you doing that, even with the knee bent, the hamstrings will kick in. These are basically the slave muscle for hip extension. They will always work. And by bending the knee, you won't cut them out. Probably the better way of doing it is this. Squeeze your buttocks together hard as you can, and you simply put your thumbs into the glutes. Don't let me push in, and you push down into the glutes, feeling for one side just to give way. And then you can repeat that test again, looking for fatigability.